Hello and welcome to Asian Pulse. I'm your host, Shannon Permal. This is the first time I'm back into the studio after 10 weeks of self-isolation due to the COVID-19 pandemic. I missed hosting the show and it feels great to be back. But more importantly, how are you all doing? This COVID-19 pandemic is not over yet, by no means. So we strongly encourage our viewers to not leave their homes for non-essential trips out of the house. If you're back at work or leaving the house for important reasons, please make sure to take the appropriate safety precautions by having your masks on at all time, wearing gloves, and maintaining social distance from others. We are into a soft opening, but don't get that mistaken for a complete return to a normal life. There's a good chance that of a second wave to come. History has proven this time and time again after each huge outbreak. There's always a high risk of a second wave too. Whether you're young or old, this virus doesn't discriminate between age or ethnicity. We've been talking a lot about self-care, self-reflection, mental health, and so forth in the previous weeks of our show. But today, we'll be talking to a palliative care nurse who works out of the BC Cancer Clinic. She'll be talking about the end of the life journey, which none of us are prepared to talk about. With that being said, I'll be right back in a flash. Camilla will be speaking with Zara Lalani, who works with the BC Cancer Agency. She is one of the many individuals who help prepare families, loved ones, for the end of life journey. So please take a look.
In our today's show, I have a very special guest that is in our studios, and she will introduce herself a little bit because there's so much for me to introduce her, and I will not be doing justice if I introduce her. So she is a recipient for 2018 Shakti Award for Public Service for her palliative care work in India and in Canada. And it's called Two World Kona Collaboration. And she would be talking about palliative care, and she's a palliative care nurse. So welcome, Zara.
Thank you so much.
I have seen you so many places and heard about you so many times. But today is a real pleasure for me that I'm chatting with you and get to know you.
Thank you.
So,
Likewise.
so tell me a little bit about yourself.
Yeah, so I was born in Africa, and I left during the Civil War, came to Canada, and then eventually ended up, becoming a nurse. And I went into the nursing program thinking that I would love it, but I ended up thinking I would stop being a nurse my last semester until I kind of had a palliative care experience. And so since then, I've kind of immersed myself in palliative care because it's sort of a passion. I'm driven about it. And I've expanded that to, I'm an end-of-life doula as well, end-of-life companion. I support people who are dying that need additional support outside their healthcare team. And I do some palliative care in India with Two Worlds Cancer Collaboration, as you mentioned. I've been to India several times in a time and knowledge exchange to support nurses there, and also do fundraising for Two Worlds. Every couple of years, a group of volunteers and I get together, and we have a fundraiser for about 500 people to raise money for essential care for people who are actually essentially dying in under-resourced countries without essential pain medicine. So we raise the funds to support people in those countries.
So you do the fundraising in Canada?
Yeah, so we have an event every couple of years. It's a group of volunteers that organize it. And Dr. Cecilia Reddy, one of the also Shakti recipients,
Yes.
She's 80 years old. She's on our committee.
Oh, nice.
And we get together as a volunteer group and we try to support this cause. And last year we had about 500 people, and we raised about $100,000 for the programs there. So, yeah, so and the reason I'm involved in work in India is because I grew up in an under-resourced country.
Right.
And I always felt I wanted to give back, so that's why I'm also driven by that, by my background in having grown up there.
Zara, for those people who don't know what is palliative care, a lot of people I know, they don't know what that word means.
Yeah.
Do you want to explain to our viewers what exactly it means?
Yeah, so actually, palliative care, people are really afraid of the word, and when they hear palliative care, unfortunately, they kind of think about death and dying. But palliative care in Latin translates to the word palliare. And what it really means is to cloak, to support somebody. And so when we're trying to provide palliative care, we're trying to imagine a warm blanket being put around someone to support and comfort them. And that's what palliative care is. So if you're ever offered palliative care, don't decline it, because it's there to support you not only for your physical symptoms, like your disease. You're not just looked at as a disease, but you're looked at as a person who has psychosocial, emotional, spiritual needs as well. And it's a very holistic approach that can enhance your quality of life. So often people, like patients, are resistant when you use the word palliative care. They get really taken aback, but I would say we're here to change a little bit of that perception around that, and it's extremely supportive, and it's extremely good care. So that's what palliative care is.
So this palliative care award, are they out of the hospitals?
So there are palliative care wards in some hospitals. So people who are, let's say, have a terminal diagnosis. Let's say we're talking about cancer, and they are running into problems with their symptoms. You can get admitted to a palliative care ward to get your symptoms managed quite successfully by a palliative care team that specializes in symptom support. So for example, if you had breathlessness or pain that was not well controlled, the team would be able to try and manage that to the best of their ability, and you would also be able to go home if you wanted to. Sometimes people that are admitted to a palliative care ward will end up transitioning back home, and maybe going back to normal life for a while, or going home to die because their disease has progressed so much with palliative care at home, or even have the option to go to a hospice home where they would be looked after by nursing staff, but in a non-sterile kind of environment, in a home-like environment.
So as a nurse, you could have chosen anything. You could have an ER nurse, you could be in the maternity ward, but why did you choose palliative?
That's an excellent question, because like I said, when I was in the nursing program, I was about to finish the program, and everyone had their passion, and it was like maternity or like ER surgical, and I'm like, I just haven't found my thing, and I don't think after I finish this degree, I don't think I'll be able to work as a nurse, because I hadn't found my calling until that last semester where I had taken care of people that were dying, and I was so anchored in those moments, and I was so able to be fully present. And what I learned in those moments is that when someone is in that vulnerable state, and you provide them with support, and you're not scared to be there for them, there are no boundaries. So any boundaries around race, religion, creed, whatever that is that you have, they just kind of dissipate, and you're just two human beings or two souls connecting. And I've never been so welcome into people's lives like I have been when I'm providing end-of-life care. And for me, that's an honor and privilege, and I go home quite grateful that I get paid to do that work. So I found my calling at the end of my program. And so, that's why I continue to do the work, because it is extremely rewarding.
So I'm just thinking, what would your regular day be like? What do you do? You work at BC Cancer Agency?
Yeah, so I actually started as an oncology nurse. I was the nurse that gave the chemotherapy. I'm the nurse that looked after people receiving treatment. And then I transitioned off and worked in a hospice for a while. And now I'm actually part of the pain and symptom management palliative care team. So people who are undergoing treatment that are running into problems with their symptoms or transitioning toward the end of life phase, but their symptoms are not well controlled. There's a team of experts. We have a few physicians, and I'm the team nurse. And basically we are an outpatient resource. So patient would come to us, and we would help manage their pain. So sometimes cancer pain can be quite unmanageable for some people. We have experts trying to do their best to make sure people have good quality of life because they have good access to pain medicines, and sometimes tweaking that many, many times to get to the right recipe for that particular patient.
So
Yeah.
you stay with that patient all the time until.
So we have, so because we're an outpatient facility, we're in contact with the patients
Yeah.
by phone or by appointment that they come in. If they run into problems, they would usually pick up the phone and say, you know, like the medications you provided are not effective, or now my pain's gotten worse, or now my nausea is worse, or now I have breathlessness. And we'll try and manage all those sometimes clusters of symptoms. So I'm kind of the resource person. They would phone and say, I'm running into problems. I'm their point person. And then I would connect with the physician and we would tweak things or bring them back for an assessment, that sort of thing. So as part of the cancer journey, there's treatment, and then there's also obviously, you know, people that run into problems with treatment side effects or are transitioning now that they're ending their treatment. So they've had many lines of treatment and are quite symptomatic. So looking at that whole continuum and providing support.
So you are talking about patient care. What about the families, the loved ones?
Absolutely. So the family is integral to the patient support system. Whoever the patient deems is important to them is part of that team. And so when we look at a patient, we're looking at them holistically, including their family. It's really important for them to be part of that conversation and be part of that support for their loved one if that patient so chooses them. Yeah.
You know, we always hear when a baby is coming, we celebrate baby is going to be here in a couple of months, 9 months, 8 months, whatever. There is always a celebration. But we do not talk about end of life. We are so freaked out
Yeah.
to be talking about what would the end of the life be. Nobody wants to prepare for that.
So
Even making wills and estates and all that,
Yeah.
60% of the people don't even have it. You know, so I'm saying that why is it that we all know that we were sent to this earth,
Yes.
and then there will be end of that, gonna come and you're gonna go, the exit,
Exactly.
the entrance and the exit.
Yes.
So why is it we are so freaked out about not getting prepared for the exit? Have you?
Yeah, it's. I find it's just part of the norm in our culture is to shove it aside, and I want to bring it to the forefront and say let's normalize it. Let's use the word death and dying, because I look at it like you said. You know you're gonna die. Well, you've come with a one-way ticket when you were born for your exit. You have a flight out, so you can put that ticket away and ignore it, or you can say I have this flight. I know it's gonna happen. Do I plan for it? And if you plan for it well, then when you get to that place, sometimes it's sudden. Like a lot of people want to die in their sleep. And I would say, I'm the person that would say, I want a bit of time to say goodbye and have love and support around me. I think that's what I would want. But when you have a plan in place, then even if your death was sudden, for example, your family wouldn't be left with wondering what to do with your estate, wondering about things like that. So I think it's really important that we start that conversation, because you can't choose how you're going to die. And just like birthing is a process, death is a process. It's not always easy. It can be challenging, and you don't want to be planning for that when you're going through a difficult phase. And the end of life phase can be difficult if you have a terminal illness, because you are grappling with symptoms at that point sometimes. And so plan for it ahead so that you can focus on your life and be present and fully be engaged in that process. That's my hope.
And I think also there are certain people, or I have seen a few people already, that they planned because they knew that they were not going to make it.
Yeah.
I mean, this is a third or fourth stage cancer
Yeah.
patient or seriously ill, or people that are in the car accident or something. They know, but they know that and they write everything down, how many people they wanted their funeral, who should be called first,
Yeah.
what they want to do with their body, whether they should be done for research or all that. So do you also find that some clients that you work with, that mentally, emotionally they are prepared and they know what to be done for themselves after they're gone?
Yeah, I mean, you know, in hospice we had like a patient, for example, that comes to mind that she's like, I want my body to go to research. That's exactly what I want. I feel like my body can serve a purpose. This is an illness I have that people need to know about. And so, yes, some people are very detail oriented in their plan. And I feel like that you could breathe around those people because you're like, now let's focus on what's going on right now because everything is in place. It's when I worked in hospice where people's prognosis is usually about 3 months. And you would be telling them, this is kind of the last stop, right? And they have not wanted to talk about funeral plans, and they die, and then the family's making phone calls to funeral homes. And on admission, I would tell patients, we need to know your plans about after you die, because we saw families struggle because patients are not willing to talk about it for whatever reason. Sometimes it's because they don't want to burden their families. So it's okay to encourage and probe people to talk about it. It makes it okay for them to do that. People sometimes are quite I would say hungry to have this conversation. They really want to have the conversation, but they don't know how.
So do you have any patient that stick out in your mind that you have stood by that patient and then final goodbye?
Yeah, so there's a lot of patients that I still think about that I have learned so much from. But a couple of them that kind of stand in my mind are one that when I first started my nursing career, and she was dying, and we called her family several times, kind of pleading and begging me. The doctor would call, I would call to say, your mom's dying, would you like to come and see your mom? And no one came. No one came to visit her. She didn't have funeral plans. She didn't speak English very well. And so that was a point in my life where I thought, wow, there are people out there that maybe their families are not engaged or not supportive, and maybe there needs to be other supports around them, which is why I became an end-of-life companion, because I feel like there are those people that don't have those supports. And then I have this lovely patient when I was in hospice who had a brain tumor, and this is how I want to be when I die. She came in and she thought she was on a resort somewhere. She thought she was in a hotel, and every morning she would come out to the nursing station and say how much she loved that her stay included all her meals, and how she loved that there was music therapy, and how she just loved her room, and could she extend her stay for a couple more nights. And I thought, wow, just whatever that shift was from that brain tumor of hers, her stay at the hospice made us all so happy, because she was like, she thought she was on a booking a
vacation.
hotel.
Yeah.
And I thought, wow, if there could be a miracle like that for me, that would be amazing.
Wow. That's a good way of putting it.
Yeah.
So do you know what has changed during this COVID-19 period of end of life?
Yeah, so I feel like this year is really about looking at things close up, bringing to the forefront. And COVID-19, basically, the most difficult part for me has been learning about people that are being admitted to hospital and your family can't see you. People who are dying suddenly that don't have plans, and those people that you would want to support, but families are not allowed in. That's just got to be the most devastating thing. And so, which is why we need to plan again. We need to communicate with our family members in case there is a sudden thing like that happens. There's a bit more communication. And also, what are we doing within ourselves to nurture our soul and our spirit, so that regardless of where you are, like if I ended up in a gutter dying somewhere, is there somewhere I could go to within myself where I know I can find peace? So the attachments to people and things, can we do some of that work? So when you're getting on this flight that I talk about, you have a ticket to, it's about unpacking. Like you need to start unpacking your load. You need to start getting lighter. You're not taking anything on this trip. So start thinking about what you want to release, the anxiety, the fear, the grudges, whatever that is, attachments to things. So I feel like if you are blessed to have a long life, toward the end of your life, it's all about releasing and lightening your load.
Letting things go.
Yeah, absolutely.
What do you do for your self-care? I have very limited time.
Yeah. So my self-care is, I'm a bit of a hermit. I like to take time by myself to go for walks, and I go inward. And I do a lot of journaling. When something is really heavy and resonant in my head, I go and I journal about it, and I pray.
Excellent. Thank you so much for
Oh my
doing this
God.
work.
It's an honor. It's really an honor. I feel so blessed that I get to do that in this lifetime.
Oh, my. Thank you so much. At least we know somebody who is so passionate about it. And even if for the sick mom or somebody,
Yeah.
that if they are in your care, they know we have somebody so caring and so passionate about it, can trust that end of the life thing.
Yeah.
And is something that we don't want to talk or don't even talk about it.
Yes.
But thank you for being
Oh my
there
God,
for
thank
the
you for having me.
and thank you for coming in. We should bring you back again.
Absolutely, anytime. I'd love to shed more light on the topic of death and dying.
Well, yes, we need to breathe now. I think I am just stunned right now. I'm just frozen. But with that, I have a song request, and this request is from Ritik. जब प्यार किसी से होता है, जी हाँ दोस्तों, ये गाना है ऋतिक के लिए. जो जब प्यार किसी से होता है, ये मूवी का नाम है दिल में बसा के. I think it's the name of the song. So this is for you, and just take a deep breath. Thank you.
पहली पहली बार जब प्यार किसी से होता है ये हाल जब प्यार किसी से होता है. ये दिल कहीं लगता नहीं, तेरी तरह मेरी तरह पागल सभी हो जाते हैं. पहली पहली बार जब प्यार किसी से होता है. दिल को करार नहीं आता, रातों को नींद नहीं आती, जान चली जाती है लेकिन आके तेरी याद नहीं जाती. तौबा मेरे यार जब प्यार किसी से होता है. होता है ये हाल जब प्यार किसी से होता है. ये दिल कहीं लगता नहीं, तेरी तरह मेरी तरह पागल सभी हो जाते हैं. पहली पहली बार जब प्यार किसी से होता है. प्यार में करूं बेवफाई, ऐसा नहीं मैं हर जाई. लाखों हसीनों को देखा, तू ही पसंद मुझे आई. होता है कमाल जब प्यार किसी से होता है. होता है ये हाल जब प्यार किसी से होता है. ये दिल कहीं लगता नहीं, तेरी तरह मेरी तरह पागल सभी हो जाते हैं. बार जब प्यार किसी से होता है, होता है ये हाल जब प्यार किसी.
Thank you, Zara. Such a subject matter is something not many are comfortable with openly talking about or preparing to say their final goodbye to their loved ones. So we hope that our viewers get insight about this end-of-life journey. Today is World MS Day, or better known as multiple sclerosis. Canada has one of the highest rates of MS in the world. Canadians affected by MS face many challenges, from financial hardships to difficulty accessing care. It can happen to anyone. Over 77,000 Canadians are currently facing with MS, and an average of 11 more people are newly diagnosed every day. Use hashtag MakeMSMatter on social media channels, encouraging them to join the virtual carnation pinning ceremony. You can visit the website at wechallengems.ca. With that, we have run out of time. Hope you have enjoyed the show as much as I enjoy bringing it to you all. But before I leave, I will leave you here with these thoughts by the Dalai Lama. A mind committed to compassion is like an overflowing reservoir, a constant source of energy, determination, and kindness. This is like a seed. When cultivated, it gives rise to many other good qualities, such as forgiveness, tolerance, inner strength, and the confidence to overcome fear and insecurity. With that, have a wonderful week. If you missed our show today, watch it on Thursday at 8:30 p.m. and Saturday at 5:30 p.m. Until we meet again, have a great week, take good care of yourself and the people around you. Stay safe and stay healthy.